I always tell my patients, think that you're gonna be pregnant for 43 weeks so that you're not impatient at 40 weeks, because it feels like 40 weeks, oh, I'm late, I need to induce, what can I do, what can I take?
The due date has become the eviction notice, and if you make it to your due date, you already feel like you're late.
Welcome to Birth from Within, where inner wisdom meets grounded preparation. We're here to share raw, real birth stories and offer the insight and tools you need to move through the system with courage, clarity, and authority. You are made for this. Your body knows what to do. This podcast is the heart work of a nurse and a perinatal chiropractor, women who have walked our own birth journeys, and now we walk beside you. In each episode, we share practical tools, grounded wisdom, and deep reverence for your body's design. Let's return to the root, because birth doesn't start in a delivery room, birth starts from within.
Welcome back.
Hey.
Today we are gonna be talking about due dates. Ooh, one of the first things also that when you find out you're pregnant, you want to know right away, right? Considering the control conversation.
Probably the question you'll be asked the most as well in your pregnancy.
Yes.
When are you due?
Yep. So it's usually, right, congratulations, your due date is blank.
Blank, yes.
And now you are everything around that date. Mm-hmm. And you think you can control your due date. Mm-hmm. And even some people even manipulate, right? Like things around because I want to give birth this day, which that to me is so crazy. Because how do we know first that due date is the day? Like there's no way, nobody can tell you when your baby is going to be here.
Yeah. Because first of all, it's actually a huge range, right? It's not just a date, and we go off a date when really it's a window.
Yeah. I like to call it guess estimate date.
Guess estimate. Ooh, that's good. Guess estimate date.
Because again, we're just guessing. We don't know for sure.
Estimate's really good because it really is an average, because it's in the middle of the 4 to 5 week window of a quotes term baby.
Yes. So back in the 1700s, there was a Dr. Nagels. Yay, I said it right. So Nagel,
as far as I know,
studied 100 women, and he noticed, right, some stuff of when these women were giving birth. What he came with was with the rule of, that is called Nagel's rule, that you add 7 days a year. Wait, let me see, but I know it's off of the last menstrual period, which that in the literature is very like, we don't know if it was the first day of the last menstrual period. We don't know if it was the last. It wasn't clear when this doctor was taking that date. So also this rule is inferring that you have a 28-day menstrual cycle, that you're ovulating the 14th day, which again, we know that we could go from 28 to 35 days of menstrual cycle. We don't always ovulate.
Another range.
14 days, yes, unless you are like following all this stuff, because there is a way to know when you're ovulating. Yeah. But if you're like,
if you're not diligently tracking,
then it's impossible to know if you ovulated that 14 days.
And so many things affect your cycle that can shift. It's so interesting because every woman
is different.
Bring a different range, but all of our due dates are calculated exactly the same.
Yes, good point. So we are all different, but we use the same date way to calculate the due dates for everybody. So right there, already I'm thinking, okay, so this is the average, this is not me. What is considered to term? If you pass 41 and 6, now they're calling it post-term baby. And if you go before 37 weeks, now you have a preterm baby. Like those are the premature ones. The thing with this rule, so the way that we calculate that he said, it was like to add in 9 months and 7 days to your last menstrual period. But again, we're all different. We all ovulate different. We are different stressors that can affect that due date. So what is the percentage of babies that come in their due dates? Is at 5%.
5%.
And
Very
if
low.
you very low, and there are factors, right, that will change this due date. Big one being first-time moms. First-time mom take longer. First, because the body is not used to be right to grow a baby and
Yes.
to go
Everything's
through
new.
all the process. So that's all new for the body. So it'll probably take longer. The factors that will affect if you have a long birth, the first one, mom being first time mom. The second one, longer implantation time. So again, we don't know when that conception
When
really
you say longer
happened.
birth, you mean going later?
Going
Well, it's
later.
later, like post 40 weeks.
Yes. 41 and 6.
Oh, post 41 and 6.
Yes.
Okay.
Yes. That there's a family history of going longer. That the BMI is higher. That this is research saying like if the higher education one will create longer birth.
Wait, like if you're higher educated,
Yes.
you'll go
yes.
later?
Yes. Interesting, right?
Yeah.
If you're more education, then you're probably gonna like advocate more for you, like you know what's going on, and so you don't have to go
More autonomous,
with
and maybe
them.
you're not stepping in to get an induction
Yes.
or having as much.
Yes. Yeah, an invention, really, like
Yeah.
just knowing.
Okay, that makes sense.
And then the environment, the stress at the end of pregnancy, because stress can definitely stop things.
Yes. Stress is the enemy of labor, really.
Yes.
Like adrenaline and stress are going to tell your body it is not safe to have this baby. And so,
Yes.
yes, that makes sense.
Yeah. So those will be like some of the factors, right, that you could go longer. So I always tell my patients, think that you're gonna be pregnant for 43 weeks, so that you're not impatient at 40 weeks, because it feels like 40 weeks, oh, I'm late, I need to induce, what can I do, what can I take, what exercise can I, it's like
The due date has become the eviction notice. And if you make it
Yes.
to your due date, you already feel like you're late.
yes,
That
yes.
it's time and you've reached the end, when that is often not the case. Like average, probably almost the average of births will go past 40 weeks.
We already say 5% goes in the due dates, on their due dates.
My midwife always said babies come when they're ready.
Yes.
And that's a big range of different humans, different moms, different environments.
But if we want to talk about getting control, right? You're like, no, this is supposed to be
I know.
today. Yeah, and today and one day it's already late.
Yeah, it's maddening to not have control. From
Yes.
mom of two with
Yes.
no control.
Yeah.
Yeah, it's hard to plan for, but you grow a lot in that discomfort.
Yes. Another thing, right, that I say, so why I love doing the chiropractic is because my goal is how can I keep this mom as comfortable as she can.
Yep.
So again, that 40 weeks come and they are like desperate. How can I can educate the best to these moms to say, hey, the longer your baby is in your belly, the better for this baby, because you have less trips to the pediatrician, or a baby that is healthier is not there is
Low risk for NICU or other.
no, yeah, and then if you're right induced or preterm, then you have higher risk of allergies, asthma, and other diseases, right? So
Lung related diseases, and that's an interesting segue into how the baby lets us know
yes,
they are ready.
Once the lungs of the baby are ready,
Which is that, correct me if I'm wrong, that's the last thing of development too,
Yes,
right? Like very
yes.
important, but that's like the final phase.
yeah, because that's what will initiate labor. So the lungs release a protein into the amniotic fluid that then tells the body like, okay, we're ready, and then starts all the cascade of progesterone, estrogen, and all the oxytocin. That is
Getting
the one
the
that is going to help you with contractions.
And what's the one that makes your pelvis pliable?
Relaxing.
Relaxin.
Yeah.
So many hormones that
Yes.
actually help equip you to
Yes.
birth your child.
Yeah. So again, talking into interventions, if we are thinking about inducing, we're already like interfering with Mother Nature, right? Because now you're adding something that the body doesn't recognize, and it's a alteration from there on.
Yeah.
So your body knows what to do, and when baby's ready, he or she's gonna let mom's body know that we're ready for this, and the cascade of events starts.
And such a good reminder that the baby is such a active participant in birth.
Yes.
Sometimes it feels like you're doing all the work, but it's your body and your baby, and really it's a practice of getting our own minds out of the way so that we can lean into our God-given, how God created the process.
Yes.
Remind me your story of dates? You have 4 babies.
Due dates, the first one, I was induced because my doctor said that my placenta was getting old, which a couple of years later, I'm like, the placenta doesn't go like, okay, 40 weeks, I'm out. Like, that doesn't happen. So really, that was like more the doctor dictated when that baby, my baby was going to be born. The second one came 39 and 5 days. Third came at 40 weeks and 1 day.
Oh, almost the due date.
And the last one, 41 weeks and 2 days.
Wow.
So the norm is like, oh, your baby's gonna fly out, 4th baby. No.
Yeah.
God was like, no, you're gonna learn patience, and you're gonna learn how it feels to go past your due date, so you can help other moms and say, I was there.
Yes.
You can do it.
The mental roller coaster,
Yes.
which is also crazy because you didn't even get to 42 where you're actually post-term.
Yes.
Because there are moms with those stories, and that's getting to be more and more rare because even midwives are under control that sometimes they can't take you on after 42 weeks and they will transfer you, and most OBs won't even consider letting you go past. I mean, a lot won't let you go past 39 weeks now.
Yes.
40 sometimes the deadline, and then it's a constant pressure to come in. You'll probably have an induction scheduled. So to get to 42s become unfathomable when you're like, that's the end of a healthy term baby. Like, we're not even quotes overdue, but you feel, we use the verbiage, I think, overdue when you go past your due date.
Yes.
So I think it's a huge mental shift we need to step into, of realizing if we plan for later, it's going to help your stress. It's going to help so much of your experience when you don't feel like the eviction date is that kind of arbitrary due date.
Yes.
So for me, our midwife always said, first baby, you're going to be late. And the whole dialogue over my first pregnancy is late. So I planned late. Like, I was just like, my due date was November 5th. And I was like, I'm going to plan for like mid to late November and just pray that the baby comes before Thanksgiving. I was like, I don't want a Thanksgiving baby, and that's really late. That's really long overdue, but I'm at least going to plan for mid-November. And that's just what I told people as well, just because I didn't want the questions of, did you have your baby yet? Did you have your baby yet at November 5th? It's like, if I just say later, then there's not going to be that period of...
Yes, because I didn't live that, but
it doesn't make it better when you're just very full, very pregnant, very noticeable. And then she surprised us and came on her exact due date, and everybody was shocked in that.
You were part of the 5% of population.
We're in the 5%. And then my second baby, I think, was 40 and either 1 or 2. Like, so I was fortunate that I never had to have the stress and deal with all of the pressure that comes with going late. And whereas my midwife was pretty much, babies come when they're ready, there was not going to be a lot of pressure, and I was very, very fortunate to have that aligned care provider. But that is such an outlier, whereas most places you're going to get, you can meet your baby, or I'm on call now, let's schedule your induction.
That's like the worst and the best line that they have. You get to meet your baby today.
And you're uncomfortable, and you can plan that. However, scheduling an induction when the process hasn't started naturally can lead to...
That's already, you're intervening with Mother Nature.
Yeah, and how your body's
You're already telling your body, you're not able to do this by yourself. You need exterior help.
And the sadder thing is, my sister had a very long first labor, and I was so afraid going into mine. And I remember she said, because I was at hers, and you see how intense it gets, and like hearing her in the night and that long period of time, I was just like, I don't believe I can do it. And she's like, your body's amazing. You don't go from 0 to transition. Your body works up, is gradual. Yes. And so there's a story in the book Holes where this guy has to carry a pig up a mountain, and he's like, I can't carry a pig up a mountain. And the woman says, you're gonna start as a baby. You can carry the baby, and every day you carry this pig. By the time it's an adult, you'll have grown your strength with it.
Yeah,
I feel like that's a very good picture of labor. But when you put in all those interventions, your body is not doing that natural cascade. You're getting often Pitocin contractions to start, and so you're starting at a way higher intensity. So it's, again, we're not saying like, you're taking the easy way out or adding shame. It's more to say, we want you to feel empowered and have the best chance.
Yeah. And do you know that you can wait?
Yeah.
Do you know that even if they schedule that induction, you don't need to show up, right? Like you can say, no, I'm going to wait a couple more days.
It feels so stressful. It feels like you're going to get in trouble. Like somebody's going to come after you.
Yes.
But they won't.
They won't. They won't come home saying, hey, your induction is today. Come on. Yeah.
Yeah, they'll just fill that bed with somebody else.
Yes.
So you are the autonomous, in charge person in your birth. It just often doesn't feel that way. And so yes, your doctor, your provider, your OB, your midwife is working for you and your baby.
Yeah.
And so you want to make sure you're a team, that they're empowering you to have a say, that they're listening to your concerns and your desires, and you want people that are going to support you and give you unbiased knowledge with the ability to make an empowered choice and not just pressure you and do the fear side, because there is risk in birth and there's risk in life. And I think so often we take those small stats of true emergencies and say, I don't want that. And they use that fear like a carrot and say, have it now because we want to avoid the risks of later babies, or the just discomfort of the unknown and the lack of planning. And that is stealing so much from us and our babies and putting us at higher risk in the end.
Going back to what you said about the waiting, right? Because you were okay with all of that. I thought I was okay with waiting and all that stuff. But on my fourth baby, when it was 40 weeks and, a couple of days, I'm like, oh my God. Like I was getting like, wow, like, okay, I'm learning how to wait. Every day will feel like a month, and that's okay. I was going like walking 3 miles at the beach. I was having sex. I was getting my dates. I was like doing all of the stuff to start labor, which again, in my opinion, when baby's ready, not in my opinion, research know that when baby's ready, produces a protein that will go to amniotic fluid and
labor will begin.
And labor will begin.
It is funny. I also looked up all the like quotes natural ways to induce labor, which the more you step into birth, the world, like alternative birth, the more they're like, that's still intervention, right? There's so many things you can do. But I felt like 40 weeks is term. It feels safe to start then, but I won't do anything until that time. Yes. But I always scheduled a massage, like, because pedicure, like foot massage, pressure point massage, like pressure point, your pressure points that can help induce labor, chiropractic care. Like so, I would schedule a chiropractic appointment.
That's very funny when people are like, "Yeah, I'm 40 weeks and I want to get adjusted to go to work." It's like, I think if I had that capacity, that magic hands, I would be a millionaire right now.
I can set you into labor. But it's again goes back to also there's a huge mental piece of it, and I think it helps us feel like, okay, I'm ready. I thought it can't hurt for that one. Like you're helping with alignment, you're helping feel comfortable.
Yes.
So it also gave me something.
Yes, that's all true, but not to bring your baby.
Yes, not to actually set labor in motion. Yes. The irony is that I never made it to almost any of those things because I did go into labor before, so I missed my chiropractic appointments. I never got that pedicure. My second baby, I did get that massage, which I'm like, maybe that did, but I had things to work through. And so because of that emotional release massage, I worked through so much and then went into labor. So that's also that piece of adrenaline and fear and stress are not going to serve you. So sometimes you're given that extra period of time for both you and baby, for you to get something else ready or work through something in your life. And maybe it's fears of birth, and God's giving you that time of like, let's deal with this thing.
And if you're stressed, if I'm feeling stressed, my baby's feeling stressed, so he might say like, okay, why would I want to come now if my mom is not feeling safe or stressed or something is happening? That also interferes with when the baby wants to show up too. Wait, with the due date. So I did reach out to my midwife and I asked, hey, everybody's asking, when is this baby's coming? Everybody's asking why I'm not in the hospital, why I'm not getting an ultrasound, why I'm not getting tested, like all of this stuff. I am a birth provider. I know I'm okay waiting, but I still need for your reassurance. And she was like, yeah, some babies take longer. So what? You're okay. And I'm like, so having somebody to understand the level of stress that can put in somebody, while I was already, I already knew the stuff, but I still needed that reassurance from my midwife. I can't imagine what somebody that doesn't have, a lot of education in this or is like reading about this every day can feel when 40 weeks is coming and nothing is happening.
Yes.
Right?
And I think that's important to say there's a spectrum of providers. So if you're in the hospital under certain jurisdiction, you're probably
Yes.
going to be pushing induction and earlier due dates. I think midwives that operate like in home births tend to be a little more or a lot more loose, but they
Yes.
still have a body reigning over them that they're accountable to. Home birth midwives tend to see women go more undisturbed. And so
Yes.
they're seeing births and much more experience with those births going past the 40-week due date, the 41 weeks, maybe even the 42, and able to give you that peace of mind. Whereas when you go to providers that are used to induction starting at 37 weeks, they are not seeing those women, and so they don't have the experience with those, quotes, later dates.
Yes, yes. Which, what they say out there, right? Like, what are the risks? Well, you have a risk of C-section, of NICU, of infection, but yet all of those risks are a very, very small percentage anyways.
And increase with induction and intervention and more cervical checks and more drugs and
Yes.
on and on. One other thing that my midwife always said on top is that you were saying too, like your mental state was like you had to really work in your mind when you went overdue. But I also want to go back to like whether you've had a baby or it's your first one. I think there is so much fear surrounding like, can I do it? How's it going to go? The unknown, like, And my midwife was like, God designed that a certain way that you're not really thinking about your fear as much when you're just like, I need this baby out of me. You're
Yes.
like, I need to go into labor. And that changes so much. And that's so important too, because it helps you dissipate fear and again, surrender it because you're less worried about how it's going to go and more
Yes.
like, I'm ready. I need to meet this baby. And that is a huge and important shift. And I think that's powerful as well.
Yes. To recap, due dates, let's change the name to guess estimate date.
And know you have a wide range.
Yeah, always plan for 2 or 3 weeks later.
Yeah.
It's okay.
Yeah.
One of the ways you can know if your birth, how is your birth provider in with all these ask
Ask
questions.
early. Maybe don't wait until you're 40 weeks.
Yes.
When you're getting your care team, you should say, what happens if I go to 42 weeks? What's the plan? Or past 40? Like how much pressure is there for induction?
Yes.
What happens if I don't come? Will you let me? Like, even will you let me? You're in control. You never have to show up, especially in a hospital.
Yes.
They're not coming for you.
But now
asking
knowing that, that this exists, we are encouraging you that if your plans is to have vaginal undisturbed birth, then ask this question early on.
Yeah, and that pressure will get in your head if you're with someone that's not aligned and saying like, we are at 40 weeks, that's kind of our end date. That's going to be a stressful week if you go 1 to 2 weeks over because they're going to be hounding you. And then that gets in your head. And so you need to protect that space and your peace and your state of mind. And so you want to know early on if you guys are aligned.
Yeah, because however we're birthing, we're imprinting those emotions to our baby too. So it's like, how do you choose your baby to be born? Happy, I'm ready, we're here for you way, or oh my God, is there something wrong with me? Mm-hmm. Again, you can wait. The rule is just an estimate.
Yep. Not a
eviction. Complete, yep. And the longer your baby is in your belly, the more benefits that baby will get. And remember that once that baby is out forever. Like, why would you stress about
That's so true.
having it already? Like, you can wait.
If I could go back,
2
I would take an
more
extra
weeks.
Give me that week of pregnancy.
Yes, that week that you can still, like, if you're a first time mom, there's an extra 1 or 2 weeks that you can sleep more.
Yes.
You can keep cleaning. You can
if
do
you're
other
sleeping
stuff.
when you're pregnant, I
Well,
think
yeah.
it does get worse. You're peeing
Yes.
a lot, but yeah, it's hard. But just like in birth, the pain and the discomfort, your body, if you hold it, but you don't remember in a way, you're like, you're uncomfortable in the moment. But if you can just get through that moment, that's again preparing you for birth and preparing you for what's ahead.
Yes.
And so you can use that and glean from it instead of bowing out and taking it into your own hands.
Yeah.
The information provided in this podcast is not medical advice. It is anecdotal and for general knowledge and informational purposes only. It is not intended to substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare provider with any questions you may have. The use of this information is at your own risk.